a sought-after speaker at international conferences and recipient of the prestigious awards, including Forbes and the International Diabetes Federation. He embodies a holistic approach to wellness, blending medical science with yoga and meditation. Driven by a vision to impact 1 lakh lives by 2030, Dr. Tripathi continues to evolve himself and his organization, guided by a commitment to revolutionize healthcare and improve global well-being. Dr. Tripathi, the stage is all yours. Please take over.
Thank you so much, Dr. Pratima. And it's a joy, in a way, to connect with many fellow doctors who are on the path of helping others through, holistic changes besides just giving medications. So I believe each one of you can, in fact, switch over to a video mode or not, and that's fine. What I would love to do at the beginning of this talk is just gather a little bit of any particular focus area that you would like me to share. Okay. The reason being, if it was just patients or participants who wanted to join a particular program, I would have had a certain flow and a set flow. And I can just go by that. I already have a presentation ready and I can take you through that. But in the beginning part, hello?
Yeah, please carry on, Dr. Tripathi. We can hear you.
Yeah, I think it'd be good that everybody remains muted and whatever they want to suggest, they suggest as a chat window so that we can move faster. So if any one of you has anything specific in your mind to ask me or get this session, have a certain focus on, please do write in the chat window immediately so I can add that in and modify the session. Because many of you already maybe meeting patients, guiding them. There could be certain challenges you're going through. And it's been 11 years that we've been doing this work with a lot of hits and misses. We've had enough successes. We've had enough relapses in 11 years. So there's a wealth of wisdom gathered over a long period of time. So anything coming to your mind, just take let's couple of minutes, so that we can answer. Vasant is not able to hear. Can others just give me a thumbs up if you're able to hear me loud and clear?
We can hear you, Dr. Tripathi.
Vasant, if you can just check your sound settings, it will help. I want to ask you about RO water and B12 deficiency. Okay.
Before that, there is one more question about one person asking about covering blood sugar.
Covering blood sugar, perimenopausal and menopausal. I read that also. Okay. In fact, I'll start with that itself with a photograph of perimenopausal and menopausal. Blood sugar threshold. Blood sugar threshold. Can you just be a little bit more clear? Because those basic data are already out. 5.7 to 6.5 being pre-diabetic, about 6.5 being diabetic. I don't want to delve into that because that data is already out. Anything particular in the blood sugar threshold that is there in your mind? Asritha, Vissa, Pragada. Lovely to read some of your names, which are a little different than usually what we read. Where are we joining in from? All of us within India, out of India? It'll be good to just know that.
I think most will be from India.
Okay. Maybe just write a sentence like the way Pratima introduced herself as a hepatologist and lifestyle medicine. The city you're joining from, what do you do? So in fact, I can gather some data or I can also generate references for you in terms of if you're handling these kind of cases. Yeah. But today only I got to know a fibroscan coming from 28 to 13. Okay. With the changes that have happened. Our head of department just mentioned. Some people have a higher blood sugar threshold is having 110 at 3 a.m. Then the sugar is shooting up. Okay. But that's again common, no? If the sugar is shooting up after 3 a.m., it's a part of Dawn's phenomena. Yeah, it's a part of exaggerated Dawn's phenomena, Asrita. Just read a little bit more on that. Just basically early morning, liver getting ready, that you're going to stand up, you're going to move around, and dumps a little bit of sugar. What will be interesting for everyone to note over here is in human blood, there's only 1 teaspoon of sugar, which some of you may be knowing. Okay. But some others may not be knowing that in that detail because that's not how we are taught in medical college. It's 100 milligram per deciliter, 100 milligram in 100 milliliters. So 5,000 ml, 5,000 milligram. 1,000 milligram being 1 gram, 5,000 milligram becomes 5 grams, which is 1 teaspoon, and 5,000 ml becomes 5 liters. So in 5 liters of blood, you got 1 teaspoon of glucose. Early morning, let's say ideal case scenarios, liver has 20 teaspoons stored. And that is something that most people don't know as glycogen. And then, of course, then there is fat also beyond that. And muscles have 100 teaspoons of glucose stored inside it. So totally we have, I mean, that's again a broad average thumb rule. Not that it's going to be exactly the same, because a 6-foot person versus a 5-foot person, the range will be different. This is like an average. So what happens early morning is a little dumping of that sugar in anticipation that the factory is going to get ready. 70 trillion cells are there, and they're all going to become alert and start moving around, and you're going to brush, you're going to maybe have breakfast, go to work. And any factory, before it starts, let's say if a factory starts at 7 a.m., if the workers are going to come at 7 a.m., the sweepers, the security guards, the lightsmen, all of them are going to come early, 5 a.m., 5:30 a.m., 6 a.m. to get the factory cleaned up and nice and ready. So the human body, the similar thing, your body starts getting ready in the early mornings. And that happens for you, me, everyone, whether we are diabetic or not. It's just that maybe from 80, 85, we go to 90, 95 between 3, 4 a.m. to 6, 7 a.m. And the diabetics, or those who have high insulin resistance or a little bit more fatty liver or more sugar in the liver, they start dumping a little bit more. Usually sugar should spike when it dips to 70 or lower, but anyway, individual case we can take a little bit later. I don't want to get sidetracked into a small bylane when we need to look at the highway. So quickly, can everyone just share the city where you're from and what do you do in terms of your work? Just let me have some references. We've kind of spent around 6, 7 minutes on it. Another 2, 3 minutes could be valuable to just get a grasp of what could be your potential needs, even if they're not coming out clearly.
Just to give you a background, Dr. Tripathi, we are mostly plant-based doctors who are looking at treating patients with, the nutrition. So the Pan India stands for Physicians Association for Nutrition. So we are looking at treating patients with more looking into their diet aspect of it.
Correct.
So most of the doctors here will be having that kind of a background and would like to
Sure.
follow that.
More of that. Okay. So Hyderabad nutritionist, Gurugram chef, Panchakula run a foundation, Mumbai nutritionist, Belgaum, Hyderabad. So a lot of nutritionists we have, maybe 60, 70%, and 20, 30% Coimbatore, Dr. Suvetha, public health. So we've got some doctors also. West Bengal nutritionist, community medicine specialist, Dr. Vinesh, Bangalore, last sem of BSc. Okay. Pune nutrition student, Anishka. All right, interesting. Bangalore clinical dietitian. All right. So quite a few of you are nutritionists or a doctor with some interest in nutrition, going by the theme and the name of PAN. Fair enough. That gives me an idea of immunologists from US, work in hospitals in India and Nepal. Interesting touch on. Good to know that. So what I'll take you through is a cumulative understanding, experiential understanding that we've had as a team. Now we are a team of 150 people working together, around 25 doctors, around a little bit more number of nutritionists, all MSCs, plus then we've got around a dozen physiotherapists, okay, bachelor's and master's both, and 6 psychologists, again another 6 research people, out of which 3 are PhDs, and a reasonably sizable team of operations and sales and digital marketing. So everything at one place, called Freedom from Diabetes, operating from Pune. And the journey started with a interaction with Dr. Nandita Shah, who many of us would be knowing that she is one of the pioneers on plant-based nutrition in this country and many other countries. So it started in 2010, 2011, in fact. I couldn't attend a program immediately, so I talked with her over the phone and she's talking about reversal of diabetes, hypertension. I said, that's interesting. She rattled off a few books. I also searched a little bit more, and that time Dr. Neil Bernard, book was out. Dr. Gabriel Cousens, if you haven't read that book, I think all of you should read that book. Okay, Dr. Gabriel Cousens is much in depth on the insulin physiology. Okay, the absolute biochemistry of it, which is not taught in that much of detail in the regular medical curriculum. And he's got a book called as A Cure for Diabetes. So I read that. Then Dr. Joel Fuhrman, China Study, Milk the Silent Killer. I think many of these books you would have read already. I started feeling the feeling that yes, something can be done here in India. Dr. Roy Taylor's work also I came across a little later from UK. We talked of liver fat and pancreas fat. And that was very shocking that, liver as an organ. And what I found is all the information is not in one place at times. You have to search from many different sources and make meaning out of it. Like, for example, pancreas, when they were saying even 1 gram more fat in pancreas can create problems. And then sounding a little absurd. 1 gram is hardly anything. But when I just kind of searched and found that the average weight of pancreas itself is 100 grams. Okay. So if that is 100 grams, 1 gram does make sense. If it is getting accumulated inside it, it's going to be a problem. And he proved through MRI scans. So Dr. Roy Taylor is a great inspiration. Got to meet him personally. Got to interact with Dr. Neil Bernard. Had a dinner with Dr. Caldwell Esselstyn just 4 days back in Chicago. You might have heard his name on reversal of heart disease from Cleveland Clinic. Cleveland Clinic is amazing. 65,000 employees. For 25 years, it's the #1 hospital in the world on heart. And they've got a preventive cardiology, which Dr. Caldwell Esselstyn. He's 91 years. Okay. His wife Anne does the cookbook, does the yoga classes. They both drove down in a truck to the place where I was staying, Dr. Arvinda Nanjatuppa. He's a very famous cardiologist again from Cleveland. So got to meet some of these people, spend time with them, and really understand the approaches. So all of these have largely a similar approach. Some people go zero oil, some people don't go zero oil, some people promote a lot of fruits in the morning, some people say no to nuts. And yes, those differences are there in different modalities, but there are results, and everybody any change in diet we've seen creates results. So even if you just go for a 2 meal plan and you don't follow a vegan diet, at times that also gives certain degree of results to some people. Even a 2 hourly plan gives some results to some people at certain point of time. Keto diet also gives certain kind of results. But over these 11 years, I got to really experiment with a lot of these diets, dissect the pluses and minuses of some of these diets. And there are separate videos on this, which you can look up on the Freedom from Diabetes YouTube channel. You've got a healthy following of 4.4 lakh people, and you'll get a feel of all the approaches, okay? I mean, that are currently available, almost all of them. What are the good things of it and what we need to kind of work upon. Now, plant-based diet, of course, is an amazing and needed thing at a body level, at a physical health level, at a detoxification, alkalizing level, and also at the planetary level from global warming and many, many perspectives. So we also go with the plant-based diet as a beginner. We try to make the participants a little less intimidated by it by saying you need to do it strictly for 2 months, because then they suddenly feel okay, because we handle thousands of people at a time. And if you tell everyone for lifelong, you need to be like this, then you will have, okay, I don't want to change my eggs and non-veg and dairy. So we kind of approach it softly and tell them 2 months you should go strictly. And then within 2 months, many people realize the importance of it and continue being that. Some people at times add some of the other non-vegan options. And as long as they are reporting and getting results and moving forward, we allow that flexibility, because we feel when you're handling large masses, it really helps. Okay, so we started off in 2013, 2012, I tried one day programs, but then I found, getting people off milk is so difficult. In 2013, we started with the first batch of around 11, 12 people in February. And we had a very wealthy chaiwala as one of the participants. I'll show you some anecdotes. Very wealthy. He had a bungalow and all that. You can have that. Got a good shop. He's a tea creator. And we had one more person joining in from one of the best paratha house in Pune. So out of the 12 people, these 2 people were there. And I had difficult time convincing them about whatever. And my information was also limited. I came across IGF molecule a little bit later. And then I realized the insulin-like growth factor Again, it's not documented or research proven. It could be interfering at the insulin level receptors, is what I started promoting and telling them just stop it for 5 days and see what happens. And some people started getting results. So we tried to give very simple diet in the beginning, tried a 12-week program with 4 contact points, focusing on a plant-based diet, and tried to give, methi, carrot sabzi, and dudhi chana sabzi, healthy stuff. And we had the paratha house lady disappear. She said, "Your food is undigestible for me. I cannot have that because they've got such a big paratha and full of butter on it." So, India is a crazy country with crazy cuisines, and it's not one country, it's 20 countries in one country. So we need to understand that. And when you should start understanding it, standing under it, then you say, okay, I told the receptionist, call that lady again, say, next session we have biryani. We have to give good food to them. So again, it was plant-based vegan, so fair enough. We tried to use a lot of soya in the beginning. Then realized that it also has an allergic potential. It is very high on protein. It is low on minerals. It is inflammatory also at times. And we started playing down on soya a little bit. Tofu was fine, but not like a regular everyday soya milk. Again, we started learning these things over a period of time. So then we realized we tried a 3-month thing. Weight loss used to happen. It's natural, common, easy. But the rebounds and relapse also happens because weight loss, we found the journey is typically for, I would say, 2 to 5 years. If you want your participants to remain at a healthier state. And then we started realizing the other truth. And that other truth, I'm just sharing you just, the pearls which you gathered over a period of time without showing any slides right now. Other truth is you can take a person from a fat cow to a thin cow, or a fat bull to a thin bull, whatever you want to call it. But the real journey is to move that thin cow or the thin bull to a strong horse. The muscle building, the surface area has to increase, and that is a time when the caloric intake has to change, the diet has to shift. Plus, India is a land of festivals and seasons. Okay, it's a tropical country, the temperature does vary. Sorry, and there are a lot of comfort foods that people have, which their mothers and grandmothers have fed them since childhood in different cultures and cuisines. And you need to be able to adapt your program to include that so that they also get something from it, and you need to start with the diet part is what we realized. Okay, and keep building on the diet, but you have to slowly and progressively increase the exercise. And exercise part, I've been a winner of the National Intermedical Basketball Championship as I represented BJ Medical. I've done my martial arts for a year and a half. I've done, gym training for almost good for 5 years. I tried my hand at 10K marathons. I was like, okay, didn't find that so exciting. It took me 45 years. Right now, I'm 51 years of age. It took me 45 years to understand that my DNA is more of an athletic yogi. I love to do a little bit more of yoga and do some weight training and some cycling along with that. And we came up with the formula of 3-2-1. 3 days a week you do something, 2 days a week something, once a week you do something. So you kind of do, maybe some people might do more strength training 3 days a week, some people might do yoga 3 days a week, but you need to balance strength, stamina, flexibility. That's how you become a strong horse. And slowly we started popularizing this concept that no one diet is universal, no one diet is eternal. And that started cutting across a lot of minds because already people have tried intermittent fasting, got some benefit, then plateaued. They've tried keto diet. They've already tried. There's so much available on the net, something or the other people have got benefited from. And the thing which we realize happens is the moment you benefit from a particular diet pattern, your participants, then it's a experiential truth. And many times that experiential truth starts becoming the complete truth, whereas it could be a part of the truth rather than the complete truth. So we started playing around a little more with the diet and the exercise part, and the stress part, we found it big. So 35% on an average have anxiety, depression, mild, moderate, or severe, and we need to take care of it that way. And since we are an integrated human being, it's great to approach it that way. So start with the diet, okay? Because Annamaya Kosha, physical body, food body, immediately you start getting results. Build on the exercise, first cleansing exercises, chair Surya Namaskara, world's best warm up, amazing exercise we innovated, stair climbing, nitric oxide tongue. I'll give you some tips which you can also incorporate if you want. And then slowly build to yoga, some Kapalabhati, cleansing, some asana practices when you're doing fasting. And we develop like 6-7 levels of fastings. over a period of time, and then go for muscle building. And that's how we found things started getting complete. At times, staunch vegans feel, or they have become a little diluted vegans. But I just want to assure, we at our heart, we are all full plant-based, what do you say, recommenders and even followers to a large degree. And given large numbers of people that we have to handle, it's great to take a little encompassing approach to include things that goes by. Along with this, we also provided the doctor, and that was our biggest strength. We have the app whereby people could actually log in the sugars every day, weight and BP. And my direction for the tech team was I want my doctors to see the sugars, the medication, and chat window all in one window. And the doctor should be able to finish off at least 4 or 5 patients in a minute. And we started building that up in 2014, 15. And now, of course, it's shaped much better over the last 8-10 years. I tried to do Pune, Mumbai, Delhi programs in 2014, found it unsustainable, then started focusing more on Pune 15, but still it was a 6-month program. Then it took us time to understand it has to be Diwali to Diwali, Holi to Holi, Christmas to Christmas. And 17 onwards, we started offering a 1-year program. 18 came up, technology happened better. So it took us 5 years to mature the program, I would say. First cut maturing, okay? Because there was nobody to teach this kind of program. And it used to be largely offline, but then by 2018, Bombay, we started having more people joining from Pune. So we started doing a video live streaming over there, 4 contact points over 4 months, support for 1 year. And then, after some time, COVID hit us in 2020. By that time, we were already online ready. And with COVID, we just multiplied 3x in terms of the number of people who could join us. So that's the journey in short, okay, with some nuggets of wisdom that I've gathered, because I think those are relevant, because some of you would be already having a practice of, what do you say, lifestyle medicine. I mean, all of you, plant-based medicine, and it'll be good for each one of us. Because it's a big wave now. I always treat Earth as ripples of waves. Like, for example, in 1400s, this little helicopter perspective before I jump into the slides, there was, let's say, a bhakti movement happening, and there was a Mirabai coming up in Rajasthan. There was a Tulsi Ji coming up north. There were a lot of South Indian, saints coming up. There was Naneshwar Mauli and others coming up in Maharashtra. In Kolkata, saints were coming up, and there was a huge bhakti movement happening in 14 and 1500s, and there was no mobile phone to communicate, but it was just happening. And there was a whole movement for independence happening after that. There was a big revolution across Europe and all that. And then the big industrial revolution started coming up, Then if you just go on all that, then you realize, okay, there's a big knowledge wave coming up. There's a big IT revolution coming up. There's a big AI revolution coming up. There's a big pizza revolution coming up across the world. There's a Big Mac coming up everywhere. So unhealthy food revolution is happening, as ripples on the planet. And what do you say? Health reclamation or regaining, because we've been on the medical track for almost medicine related track for maybe 250 years plus now. That revolution is also happening in a way. And some of us who have gathered right now, 43 of us, and a larger population of many doctors and nutritionists are in their own ways, independently, sometimes joining hands and trying to do and contribute to work. So it's a large ripple. And from the large ripple, whatever mini ripple FFD is creating, I'm just sharing the insights that start with the diet, build on the exercise, take care of the psychological part, and have the medical thing also together so that you can kind of take things along. Percentage under 5 years of age advice to parents who bring children completely plant-based from infancy. The percentage is lower, Naveen Kinney, who are less than 5 years of age. Some of them do follow it. Kids also take liking for it. Type 1 diabetics come at times, so they benefit a lot. Certificate, comprehensive session on diet will be provided. There's no certificate, Dr. Chaitra, today. Big benefit, 20 varieties, massive variety, lower, sab kuch, upward, even corruption, pollution, weather, vegetable, everything in your name. Chappad Fadke, I know. Population also Chappad Fadke. I was in the US right now, between Dallas, Atlanta. Very interesting, New Jersey, Cleveland. I had a big presentation on mental health improvement with lifestyle modification, and we've got crazy data. Like I presented data of 8,600 people who have improved their cardiovascular risk factors. Okay, if you want, I can show some of those slides for you because you like it. Okay. And they were aghast, oh my God, 8,600 people improving their cholesterol, HDL, urine microalbumin, HSCRP, traditional, non-traditional risk factors. And at the main conference, International Congress of Integrative Medicine, some of you, since you're into integrative medicine, you can look it up. It's a nice consortium which is built up in US. I went there for the first time, and there I presented on mental health. So a good data of 700 people, 698 to be specific, and anxiety, depression coming down almost 50% for those 70%, 700 people. So with this kind of an introductory connecting thing, what we get into is a few slides and a few, what do you say? Orientation, informative, eye-opener, current scenario, that's more than enough. Thank you, Dr. Chet. More than welcome. Where is the share button? Share button, share button. Is it in the more section?
You are a co-host.
Green. Yeah, I could see the green button. Okay. So this is part of the presentation on reversing diabetes, obesity, and lifestyle disorders. So visually, what it could look like in terms of patients or participants is a fat bull, or I mean, not derogatorily mentioned. Okay, please. It's just to drive home the point. Fat cow to thin cow to strong horse. This is how reversal could look like. And menopausal woman was the question asked. So she's very much menopausal. Reshma Arole, she's 50 plus and looking like a college going girl, like elder daughter of her sister. And many of you might have also such kind of case testimonials. So the journey is finding the identity, besides, focusing on being a plant-based, follower, largely or completely. One has to find one's calling for an identity, which could be a runner, gymmer, swimmer, yogi, and then align the diet based on that. I'll take some questions later. Let's cover a few grounds now. 3 key messages which I love to give to people, and in US also I was giving is, one is reversal, freedom, remission, and transformation. All is possible. Reversal is the reverse gear, and the whole vehicle goes in the reverse gear. So it's not just diabetes; it's going to be along with that obesity, BP, cholesterol, just not one tire going behind. Freedom will happen to a certain percentage. We see more than 10 years of diabetes freedom happening for around 20% plus minus few percent, more than 10 years of diabetes on an average. And I'm talking of large data. And if it's less than 10 years, it can go up to 60% also, 55, 60% freedom. And then comes remission, which we all know, most of us know, below 6.5 for at least 3 months, HbA1c. And transformation is where they clear GTT. So we are the only organization which has videos of jalebi before and after with glucometer readings, and the only organization which has glucose tolerance test participants, full data, 1,500 plus on our website. Every person's name, city, number of years of diabetes, all mentioned. And there are patients with 30 years of diabetes on insulin tablets, both going off it and still clearing glucose tolerance tests and remaining clear for 4, 5 years. But that's not the story of everyone. Everyone is unique. Everyone is different. But all of this is possible. And those who are interested more, you can look up the research section on our website for papers and conferences published at IDF, ADA, ESD, all the big conferences. And what I found and what we have found is the people who progress the most are the ones who have the student mentality. And what I mean by student is they try to go into the theory also besides the practice. So even let's say even if it's plant-based nutrition that we are proposing, even for us as healthcare providers, doctors, nutritionists, for us to learn the deeper physiological biochemistry basis is very, very important, because that's what cuts the ice for people who are well off and well educated. And typically that's the category of people which follow these kind of patterns more in general, I find. Lower socioeconomic status also follows. I'm not saying no, but at times just pulling them out of milk tea is a challenge. Okay, so if you give them simple things, कि देखो दूध में जैसा वो बर्तन को चिपक जाता है ना रात को, वैसे ही आपके सेल्स के ऊपर चिपक रहा है वो, तो वो इंसुलिन को काम नहीं करने देगा. फिर they get it. Okay, चलो फिर you have to explain a very simple language for them. What is IGF for them, So Prakash, I've read your question and I'll be coming to question a little later. Just have patience, take a nice deep breath and smile on your face. Inhale, everyone. Exhale, everyone. So, being a student yourself and also creating a student within your participants is a big skill. Making them surrender to your philosophy itself is a big journey because there'll be challenges, there'll be doubters. Once they get results, they start following better. So, and these are not lifestyle diseases, okay? I mean, they are lifestyle disorders in a way, but the roots are very deep for diabetes, BP, cholesterol. Even a pre-diabetic roots go 5 to 10 years deep. 50% of the pre-diabetics have heart blockages already begun. So these are medical problems. We have to appreciate that. When I began 11 years back, I was so optimistic. I said, do this plant-based diet, pick up this book, don't show me your face. By 2020, 1 lakh people are going to be free. But in 2024, there are 15,600 people free. Because even I've learned on the way that it's not as simple as it looks. Okay. So be a student lifelong, and that will be help. Okay. And results can start within a few days. Like stopping milk, we find that within 3 days, sugar start coming down and I attribute it to IGF molecule and inflammation also. So within 1 day, inflammatory genes can start switching off. That's an interesting part of the human body. Okay. Um, IGF molecules typically are read somewhere else. It takes maybe 72 hours to clean from the system. And we've seen, like I remember one of the patients, fourth batch, Sanjay Bagade, is still free of insulin. First day, his sugars was 256. That time he used to send us an SMS on the phone. Second day, 141. Third day, 93. And he was taking 65 units of insulin. And I knew he's going to go into hypo next day, today only. So I told him breakfast, knock 5 units. And 65 units of insulin got over in something like 18 days or 20 days. And this is 2013, still hasn't come back. He used to get admitted every year for kidney issues. He's improved also on that. So at time dairy for a person who's taking insulin, or let's say those who are on heavy dose of tablets or a type 1, the results can be so fast that they are unbelievable. Okay. And there are many reasons to dairy. I think many of us are aware of it. So clearing that is very, very useful. But the thing is overconfidence, suddenly then if within 1 or 2 months they start feeling, oh, I've been there, done that, I've become free, so I can eat anything. And you need to tell them, hold your guns. The real journey is 2 to 5 years. The problem has built over 5 to 10 years insulin resistance. Okay, go slow, no overconfidence. Even if medicine stop, the journey is long. Stoppage of medicine is just one of the platforms on a very long journey. Take it easy. And that clarity has to come in you and from you to the participant. No exaggeration, no minification, only honest truth is what works. Okay, being extremely integrous, because there is a tendency to exaggerate, which is also a mini lie, or being more pessimistic than all. Just give the percentages exactly. The way I told, with large data sets, we found more than 10 years, the remission percentage is 20-25% only. It doesn't go to 50-60%, at least with whatever we've come up with. If there's a better protocol that some of you come up with, maybe something else might happen. Less than 10 years, yes, it can go up to 50, 55, 60% also. So always be with the truth and take them over long years. Tell them it's a game which is a longer period of time, because the relapse can happen due to deeper genetic, family, and other patterns also. Okay. So these are 3 key messages. I typically make them go through the deeper reasons of diabetes and lifestyle disorders, give them around 10 tips, and ask for a commitment for long-term learning and transformation. Largest pandemic we know as doctors are a combination of all of this. And I equate to an hydra plant. You press one of the head down, the other head gets up. Press the other head down, the third head gets up. You start with diabetes tablet. After some time, hypertension starts. After hypertension, the cholesterol starts, and things like that. It keeps going on and on and on because you're not treating the root cause, which is insulin resistance. For treating fever, we need to work on the infection. For treating all these disorders, we need to work on insulin resistance. For that, you need to measure insulin resistance with the help of fasting insulin, which should be ideally between 2.6 to 6. If it's more than 6, there is resistance, and the resistance can be coming from 4 diet causes, 2 exercise, or 1 stress cause, the way we've identified over a period of time. And this is a combination of work done from many, many books. Okay, there's an 8th cause called behavior therapy, which I'm not getting into detail right now, and you can kind of clarify all these causes with the help of simple diagram. Point number 1 is the IGF connected with dairy products. Point number 2 is acid coming from acid-based food, late nights, too much of glucose rising, too much of fat rising, because glucose is acidic, fat is acidic, fatty acid is there. 3 is, we all know Dr. Neil Bernard's fat inside muscle cells, intramyocellular lipid, but the more dangerous one is the liver and the pancreas fat. Less dangerous is the subcutaneous fat. So fat responds differently. So you might have a 100 kg person non-diabetic, but a 60 kg person diabetic, because they are thin fat Indians. It's a nomenclature and a concept already existent. Fourth is micronutrients. If they are less, yeah, you'll not be able to convert the glucose or fat into energy, thereby accumulation of glucose and fat that itself creates more acid and inflammation. So biggest problem is acid inflammation, which swells up the cell membrane. That's why the receptors don't open up quickly. Point number 5 is stagnated lymph, stuck up blood. Point number 6 is lack of muscle strength. And point number 7 is stress hormone. Stress hormone interfere with insulin action and thereby increase glucose levels. In response to rising glucose, you'll secrete more insulin. And more insulin makes you store more fat, and more glucose into the cells, thereby increasing obesity, activates the sympathetic nervous system, creating more blood pressure at times, makes fatty liver happen through more insulin. And there's a twin cycle hypothesis: more fat in liver, more glucose to the liver, more glucose, more insulin coming from pancreas, creating more fat again into the liver. So shift to plant-based meals or without milk-based tea, coffees. Acid inflammation is a long-term journey. Excess fat again is a long-term journey. Inside muscle fat, inside liver, pancreas fat. And Roy Taylor has demonstrated, remission patient 30% fat, 1.5% fat, 9% fat pancreas to 7.5% fat person in remission. So B3, B6, B12, C, D, E, chromium, magnesium, phosphorus, zinc, selenium, vanadium, all these micronutrients needs to be good. So some of them will come through diet, some require supplements, and we need to give supplements. Stagnated lymph, which is stuck up blood between arteries and veins, because lymph carries 10% of the blood, veins carry only 90% of the blood. And muscle strength, you don't get into immediately, because if you start building muscle immediately, the hunger will increase and then not be able to burn the fat. And stress hormone, 30-35% have to be taken care of accordingly. So this is what we've learned over 1 year, that try to make the body alkaline, improve the micronutrition over 3 months, work on the excess fat for 3 to 6 months, circulate the blood for 3 months, then build the muscles and find ways in which you can manage your stress. Give yourself for 1 year. Medically also, pancreas growth or improvement is seen over 24 months, coming to 70-80% of normalcy after months of remission, as published by Dr. Roy Taylor. Behaviorally also, it takes 1 to 2 years, because ignorance is there, and ignorance cannot be removed by one lecture. Inertia is there. We need to keep pushing and nudging the person, and individualization is needed because each person is different. That's my journey in short. I won't go into the details. You can read it up on the net. Tried 10 years of health and stress management with corporates, and then got into small batches. Savita is still free. Atul Shah over here is still free. And though large batches started coming in 2015, we learned that it's not about attracting large crowds and giving lectures. It's about hand-holding them over a longer period of time through diet, through exercise, through inner transformation and medical protocols. And we've got a huge detailing done over 10 years, 11 years on that. We make them go through 3 different diets in the first 3 months, and remodel the body and mind, bringing in stress in the next 3 months, and then take big goals and law of attraction and secret GSS sandwich vision boards over here for the 108 Surya Namaskara, 10K run, 25K cycling, and many other things, and try to make them a master. Master is the one who knows the way, goes the way, and shows the way. That's how it is defined. And basic health goes in the first 6 months, advanced health goes in the next 6 months. And the app and everything is designed along these lines. And if you want, you can look up on the website for more details of this. So phase 1.1, we ask them to stop milk and milk products, start with the smoothie. Breakfast is going to be sprout salads and cooked dal-based items, 25, 50%, and 25% each of grain dal, cooked salads, and these things. Soaked nuts and seeds, typically almonds, walnuts in the evening, and 3 to 4 teaspoons of seeds. Seeds contain minerals, and many of the problems are because of demineralization. Many of us don't know that minerals make our body alkaline. If the body's pH is continuously acidic, the raw minerals from the muscles and the bones and actually create more osteoporosis and sarcopenia. So that is muscle loss. And exercise is due to the world's best warm-up, circulate the blood and the lymph. Super brain yoga, chair or regular Surya Namaskara, and anti-gravity exercise, stair climbing, and nitric oxide dump. So these are 10 tips which I do give in a lot of free programs or subsidized programs, and people follow that and benefit also. And this is where we already published all our researches. 38,000 people have joined from 10 countries for the 1-year program. And these are the statistics. 50,600 free, 4,000 free of BP cholesterol and 4 lakh kg weight loss done. Because I was in US, we had taken a lot of US samples of people who are off insulin. I'm sure many of you have many samples like this also. But combination of problems going away is unique in terms of metabolic syndrome, or even 74-year young person clearing GTT. There are some very, very unique achievements. Sometimes pre-diabetics keep hanging around for too long. So that's it from my end in terms of a little bit of getting to know who you are in first 10, 12 minutes. And I think it was good that I got to know that the crowd is this. And I tried to capture a lot of things in a short time. Okay. If half an hour. But broadly, this is what it is. So we can take a few questions and look at your challenges or anything you want to learn further. Formula and diabetic dietary plan and your standard criteria to follow related to that. Dr. Chaitra, I've just given you certain aspects of the plan of the smoothie and breakfast and lunch and dinner and some nuts, which is a good start for people. But again, based on BMI, you have to modify uric acid, thyroid issues, kidney issues, all has to be modified. So start getting into communicating to them that, don't look for one standardized plan, because no one plan is universal or eternal. You cannot follow the same diet every day for your entire life, or even for that matter, a year. You have to modify it. Taste wise, craving wise, there are so many challenges that come up, which requires modification. Unfortunately, plan has less or no effect on genetically based lipoproteinase. So be it, Prakash. A genetic problem is a genetic problem. You need to appreciate it. It's simple. If it's a dominant gene, no diet is going to change that. Insulin random 4.1, C-peptide 19.3, some aberration over there. Random blood glucose below 60. What can be the reason for 60-year-old women's sudden hypoglycemia? So there is definitely over-secretion of insulin. Random insulin is not a good measure. C-peptide is very, very high. 19.13. I've never seen fasting C-peptide. If it's a PPC peptide or a random C-peptide, then you can correct. Ideally, C-peptide levels fasting should be 1 and above, a little bit more than that. If it's going above 4 or 5, you can anticipate a lot of insulin resistance. Okay. So it's high insulin levels which create hypoglycemia. It's called reactive hypoglycemia. Okay. Okay. Please share some information on perimenopausal women need to balance full sugar levels, increase with drop in sugar levels. Shalini, look, the challenge is, what have they done before getting into perimenopause or menopause? If they've done some muscle building and hormone balancing before that, it helps. Weight training, we found, really helps. Even if they've not done it before, they start a little later. After initial detoxification and cleansing, alkalizing diet, cleansing diet, they can start with that. It will help them. So Reshma Arole is an example of that. Order V affects the sugars. Yes, it does. Start with the salads. We all know that. Ramanendra Kupuswamy, what you need to do is work with the person to reduce the insulin resistance. That will reduce the insulin levels. That will reduce the hypoglycemia. How to assess whether to start muscle building considering the individual response. You set up a target, like at least a 3 to 5 BMI point drop. Look, ideally we know, let's say even about 23 BMI is now obese for Indians. Okay, about 27.5 is, overweight and obese after that. So try and, if somebody start 35 BMI, at least get them 5 point down to 30 BMI and then start muscle building. If somebody is at 26 BMI, try to get them to 23 and then start muscle building. Methylation defect and mitochondrial defect. If it's a genetic defect, Dr. Jagdish, I don't have any answers. B12D supplements must be given. Measuring PP insulin levels. Is there any logic? Yeah, it's just good to get a feel of C-peptide PP is more accurate than insulin. So if you want to assess actual insulin secretion, better do C-peptide. But if it's there in front of you, look, after a meal, you need to secrete at least 5 to 10 times more insulin than fasting. So that's how it is. Supplements, a little bit more on lymph stagnation. Look, arteries take the blood far away. Okay. In the body, veins bring it back. Just 1 second, something urgent has just come up. Strength training for years, but still blood sugar. So arteries take the blood far away, veins bring it back 90%, 10% is stuck up all around, and that's why You require lymphatic circulation because most of the people get stuck up with walking. Walking is good for the legs and for the heart. What about the trunk? Most of them have a heavy trunk and thin arms and legs. So they need to bend the spine, compress the trunk, compress the spine. For that, Surya Namaskara really help. I've done strength training for years, but still blood sugar have been high. So, you know, muscle surface area is just an added benefit you get because of strength training. If the insulin secretion is not that great, sugars are going to be high. Plus, we need to clean up the diet also. Great. Anything else, anyone? You can just type it quickly because that makes it faster. Thank you, Sir Sarani, and thank you, everyone. Tailored treatment for individual patients, sir. What would the trailer treatment? We see all the reports, all the 14 reports, and based on the reports, we tailor the diet, exercise, medication, supplements. K2 supplements, I don't have much experience on that. For collaboration, heart doctors, yeah. Write to me at Dr. Pramod at freedomfromdiabetes.org. If you want to discuss anything further. Three days, Bharat Goel. 3 days, 5 days, doesn't take much time. Improvement can happen. Supplements 1-to-1 level, Bindu Mol, based on the B12, D3, iron, calcium, other levels. All right. Dr. Pratimaji, thank you very much for the invite. Good idea to stop grains at night if a patient. Yeah, you can do that, Sanchita. Pulses, pluses and minuses of plant-based diet. What are the minuses? You just have to keep a watch on the overall caloric intake, overall protein intake, overall fat intake, and also look at your B12 levels regularly. Sometimes some people react with too much of fiber in the beginning, okay, with constipation or loose motion. So you need to tweak it accordingly. Consideration for precaution for older orders like mother gallbladder issues when implementing these changes. One-to-one discussion will be needed. Just older doesn't qualify for much, but yeah, those who have gallbladder issues shouldn't do fasting immediately. Protein deficiency in the population. It's too big a question. Population is made up of too many people, okay? And it's made up of subpopulations within that. Also read a book called Proteinaholic, which gives a perspective on maybe we are going too much on protein. We don't need to go so much on protein. Okay. So it's a very nice book written by a pediatric surgeon, Garth Davis. So he questions even the 0.8 ka formula, 0.8 milligram per kilogram. Okay. So Dr. Sanjita, it's better to discuss the cases rather than the population. Yeah. In general, the population may be on a lower intake, but that's like what to do with that then? You know, it's like that kind of a problem. And none of us can treat the entire population. You can always work with a category of the population. So work with your category closely, understand them better. Name of the book, Proteinaholic, Dr. Garth Davis. Any tip for lymphatic drainage? Watch my world's best warm-up on YouTube. There's a rubbing, there's a joint play, there's a shaking, there's a tapping, and also do the regular or chair Surya Namaskara. You'll benefit from that. Pratima ji?
Yeah. Thank you. Thank you so much for you took over the whole thing so nicely, Dr. Tripathi. You even made our life easy by taking the questions yourself from the chats and answering them. And you have really given us a holistic view of how to manage diabetes, whether it is with the diet or with your exercise, or you are laying a lot of emphasis on the mental health, which is really not looked in the mainstream medical practice. And that, I think, plays an important role in taking care of patients' health. And you really have made it holistic and introducing the exercise. And I like the way you said that although it seems a little crude to be taking from, from a making a buffalo to a horse, it really makes a difference. We really need to build our muscles, and we can only do that through the strength training, which you have placed so much emphasis on. And it's very remarkable to see how you have been such an influence, and how you have managed to involve so many people and transform their lives. And you made it like it's not a quick fix, not that, today and tomorrow. It is a year's journey, and it's a lifelong journey which people have to go. They just can't give up halfway through. Thank you so much, Dr. Tripathi, and it has been a pleasure having you talk to all of us. Thank you.
Thank you very much, and super success to all of you to be amazing students of the holistic health path. All right, and transform lives of many people. We are a part, all of us are part of this ripple of health wave, and we just need to do our level best and just go full on it, because the problem is big out there. It's like 15,000 free is nothing. I find within this 11 years another 15, I mean, lakhs of people have become, not 15 crore have become more diabetics, but seriously, the problem is very big out there. So all the best to all of us. See you.
Thank you. Thank you.
Thank you. Bye.
Right, everybody. Thank you.